Focal segmental glomerulosclerosis is a disease that affects the functionality of the kidneys. One of three types of this disease can be present in a patient. Several lab results, if found together, can lead to a diagnosis. Focal segmental glomerulosclerosis can eventually end in kidney failure. The cause, treatment, and progression of this disease depends on what type the patient has. First, let's discuss the basics of this kidney disease. Focal segmental glomerulosclerosis, or FSGS, is a disease where scar tissue develops on the glomeruli in the kidneys. FSGS is a fairly common disease in the United States and is the most common cause of idiopathic nephrotic syndrome. In the name of this disease, focal represents the fact that only some of the glomeruli in the kidneys are damaged. Segmental signifies that only portions of the glomeruli are scarred. Finally, sclerosis represents the scarring on the glomeruli. The glomeruli filter and remove waste products, impurities, and extra water from the blood, creating urine. This condition can affect any age. It is more common in men than women and affects the Black population more often than the white population. In this picture, you can see the glomeruli on the left is healthy, and then the one on the right has that black portions on it, where you can see that's where the scarring is and how that would affect how well it will filter the blood. Three types of FSGS have been identified: primary, secondary, and genetic. Primary FSGS is often idiopathic or has no known cause. Secondary FSGS can be caused by a variety of conditions. Some of the pre-existing conditions that can cause secondary FSGS include viral or bacterial infection, diabetes, sickle cell anemia, obesity, or other kidney diseases. Genetic FSGS is very rare and is caused by genetic mutations in the patient's DNA. Many patients with FSGS are commonly asymptomatic, although patients can come in with some common complaints such as edema, weight gain, or hypertension. Now let's look into the abnormal labs that you will find in a patient with FSGS. When FSGS is suspected in a patient, a couple characteristics of their urine will be present. The first indicator will be a foamy urine. This foam is a product of proteinuria, which is a predominant feature of FSGS. When the patient has scarred glomeruli, protein can leak into the urine. This is also called nephrotic syndrome. Any protein in the urine is abnormal, although nephrotic FSGS patients will have greater than 3 grams per day. Consequently, the patient can have low levels of protein in their blood. Hematuria and reduced glomerular filtration rate may also be present. High fat and creatinine levels in the blood can also be present due to the decreased filtration ability of the kidneys. Creatinine levels in the blood will be greater than 1.3 milligrams per deciliter. Edema is also a common sign of FSGS. Since the glomeruli aren't working correctly, they aren't filtering out the extra water in the blood, causing fluid buildup. This extra fluid often collects in the legs, ankles, and around the eyes. When these signs are present, a kidney biopsy will need to be performed. This biopsy will confirm whether the patient has scarring in their glomeruli. Finally, we will look into some possible treatment options for patients with FSGS. Treating FSGS is not an easy task. The different types of FSGS greatly impact how the patient will respond to drug therapy and how their disease will progress. If the patient has secondary FSGS, the first step will be to treat the underlying cause. For example, if obesity caused their FSGS, the patient would need to lose some weight in hopes of stopping the progression of the disease. The patient would also often be prescribed with a medication that will decrease amounts of protein in the urine. Two common medications to decrease the amount of protein in the urine are angiotensin converting enzyme, or ACE inhibitors, and angiotensin receptor blockers, or ARBs. The patient would also often need to control their blood pressure. Prednisone and immunosuppressive agents may also be prescribed. The patient will continue to have their cholesterol and kidney function monitored with blood and urine studies. The amount of time a patient could be receiving treatment varies greatly, between 2 and 20 years. As stated before, if left untreated, patients can go into kidney failure. Once renal failure is reached, the only treatment options are dialysis and/or a kidney transplant. Despite attempts to halt the progression of this disease, patients will often still require dialysis. Progression to complete renal failure in nephrotic patients can take between 5 and 10 years. Non-nephrotic or patients in remission have a much better prognosis. When a patient enters remission, their 10-year renal survival rate is greater than 90%, although for patients not in remission, their 10-year renal survival rate is less than 35%. If renal failure is reached and a kidney transplant is given, FSGS can reoccur in the new kidney. In fact, 25 to 50% of patients have FSGS reoccur, sometimes within days of the transplant surgery. The following is a summary of a case study. Imagine you are working in the lab and you are presented with a patient with the following signs and symptoms. The patient is a 67-year-old Caucasian man. He came into the emergency room complaining of edema in his lower limbs, shortness of breath, and nausea. Upon examination, he was found to be hypertensive. A urine study was performed and the following results were found. The chemical examination showed a 3+ blood and a 4+ protein. It was revealed that the patient had renal impairment with elevated creatinine. A 24-hour urine was collected and protein levels were measured at 10 grams per day. The patient then underwent a renal biopsy. 5 of the 27 glomeruli examined had segmental lesions. The patient was then diagnosed with early FSGS. The patient was prescribed prednisone, which improved his creatinine levels and serum albumin levels. Focal segmental glomerulosclerosis is a disease that affects the glomeruli in the kidneys. A patient can be diagnosed with one of 3 types of this disease. Several tests need to be run in order to diagnose a patient with FSGS. Some of these tests include blood and urine studies and a renal biopsy. The progression and prognosis of this disease depends on what type of FSGS the patient has. Thank you for listening.